Every woman has a pair of ovaries, which in the reproductive age group produce a lot of hormones and produce monthly eggs. These eggs are the basis. When they mate with sperms, they form babies. So ovaries are the organs which help a woman carry forward the progeny and also produce all those hormones which make her so attractive and womanly. Ovarian cancer is quite prevalent and its incidence is increasing. Like in the last study in 2020 in India from the cancer registries, they have found that the cases are increasing, and in various centers the percentage varies from 1.7 to 15% of all cancers. That's how important it is becoming. And there are basically two types of cancers of the ovary, which are primarily belonging to the ovary. They can be from the surface or the epithelium, and they can be from those cells which are the eggs or the germ cells. So depending on what type it is, what age the patient belongs to, and what stage the cancer has been caught, we can determine what will be the prognosis, what treatment she requires, and how to manage her further. Usually there are no early signs or symptoms. Most of the time it's a silent, very deceptive thief. It keeps on eating up your body, growing inside slowly, silently, and one day, most of the time, the woman will go for some other irrelevant problem, and it will be caught on an ultrasound or an examination or a CT scan, and most of the times it's found when it has spread beyond the ovary. So that is the main drawback of an ovarian cancer. Many treatments are being done for it, but so far to catch it early is the biggest treatment of all. Most common would be that the woman will slowly find that her abdomen is swelling up. They take it as a part of gaseous distension of the middle age or old age. Sometimes they tend to lose weight because of it. Sometimes, very rarely, they may have bleeding associated with this, and there is that point of time one can catch it very early. Although it has been tried in various centers all over the world to do an ultrasound maybe every year and some blood markers, but they have found that they are not cost effective. Even after doing these tests repeatedly, it is not very easy to catch early ovarian cancers. The treatment involves the chemotherapy, and there is so much of advance that now there are instruments which put in the chemotherapy inside the stomach, intestines, all around the abdominal cavity, and kill the cells which have spread. So depending on what stages it is, it can be removed or it can't be removed. Chemotherapy, there are various types depending on the type of cancer it is, and then depending on the time since it has spread to the adjacent organs or across the whole body, the treatment plan is modified. Ovarian cancer is known to have a genetic prevalence. In the family, there may be other people with a breast or an intestinal or ovarian cancer or the cancer of the colon in the males. So if any of such history is there and the relative has been investigated, the genetic screening has been done, the same genes can be studied in the women also, and accordingly action can be taken. See, the ovaries are very important for reproduction. So basically we wait till she completes her family, and then the ovaries and the tubes can be removed. There's another prevention which is now being propagated. They say that the fallopian tubes, we tie up the tubes when we don't want any further children. They say the secretions from these tubes fall on the ovaries, and somehow they instigate the ovaries to go into a cancerous change. So whenever it is possible, for whatever reason you are doing a surgery of the abdomen, and the woman has completed her family, these tubes may be taken out, and they will decrease the incidence of ovarian cancer in future at a later date. Besides, once you've completed your family, if you take oral contraceptive pills till such time that you go into menopause, that is also a preventive measure which has been found to be very useful, that till such time you take these oral contraceptive pills, your incidence of contracting ovarian cancer goes down. So these are some of the tips, and as early as you feel some bloating, some problem, go to a doctor, get an ultrasound done. An internal ultrasound picks up ovarian tumors, they may be cancerous or non-cancerous at an early stage, so that one can be investigated, and if the need be, have the tumor taken out.